Airborne pathogens are any organism that can cause disease and spread throughout the environment via the air. Typically, airborne diseases travel on dust particles or respiratory droplets by way of sneezes, coughs, laughter, and close personal contact. Airborne pathogens can enter through the eyes, nose, and mouth. Some of the most common examples of airborne diseases include influenza, chickenpox, and whooping cough. Although these diseases can cause serious harm and even death for some patients, they're usually easily curable if diagnosed and treated in time. More life-threatening airborne diseases include meningitis, anthrax, SARS, tuberculosis, and smallpox, though vaccines have advanced such that these diseases can be prevented. Transmission occurs, 1, through the air. If you are ill, use good hygiene. Cough and sneeze into a tissue or sleeve. Dispose of tissues in a trash can. Wear a surgical mask. Keep a distance of 6 feet between yourself and a sick person. 2. Touching contaminated objects. Avoid touching contaminated objects. When around ill people, avoid touching your eyes, nose, and mouth. On average, people touch their face 16 times an hour. Keep an area disinfected to kill pathogens that have contaminated surfaces. 3. Hand contact. Wash your hands thoroughly if in contact with an ill person. Wash for 20 seconds, which equals singing happy birthday twice, or use alcohol-based hand sanitizers. Keep current on vaccines, although not all airborne pathogens have vaccines. According to the CDC, healthcare workers face a greater risk of exposure to ABPs than the general public, as do correctional institutions, shelters, schools, long-term care facilities for the elderly, and drug treatment centers. When you are ill, call a doctor if your fever is high. Ask your healthcare provider whether antiviral medications are needed. Stay home to prevent spreading the illness. Rest. Drink plenty of fluids. Take recommended medications. Get medical care right away if you experience difficult breathing or chest pain, purple or blue discoloration of the lips, vomiting and unable to keep liquids down, signs of dehydration such as feeling dizzy when standing, being unable to urinate.